Barry Coates, who's MP and spokesperson for senior citizens from the Green Party. Now we're yet awaiting, and we'll hold the applause till the end because that just takes time. We've got David Clark, we're waiting for his MP and spokesperson currently, I presume he still is, for Health for the Labour Party. And we have the Honourable Maggie Barry, Minister for Seniors from the National Party. We have Ria Bond, MP from New Zealand First. And we have Bali Nanda Kui Tavuki, is that pretty good?
Yes, absolutely.
Who is a candidate for United Future. Now, each of our political guests was invited to prepare a policy position that outlines how their party will address the dementia challenge in New Zealand. And you all have copies of those on the chairs. And soon we're going to hear from the speakers in person. So just to set the scene, dementia is one of New Zealand's most significant and growing health challenges, and one that affects 1 or 2 out of every 3 Kiwis. The most recent Dementia Economic Impact Report produced by Alzheimer's New Zealand says over 170,000 of us will have the condition by 2050. At that point, it will cost the government of the day nearly $5 billion a year. Last year, dementia cost New Zealand about $1.7 billion. And as you would expect, most of that was direct costs to the health system. Surprisingly, only 1.3% of that funding went to help respite care and carer support, and only 0.3% went towards research into dementia. What makes this even more surprising is that international evidence that comes from the US, from Sweden and the UK suggests that the health and social care costs for dementia match or exceed the combined costs of cancer, heart disease and stroke. Now, we're not alone in New Zealand in facing this major challenge, but we are lagging very much behind. More than 30 countries now have dementia strategies or plans in place. And for example, the UK government has made over 50 commitments relating to dementia, and Scotland has made over 30, whereas we have just made 2. Another interesting comparison is the use of memory clinics that do much of the diagnosis of dementia. England operates 222 clinics, which is about 1 for every 3,000 people with dementia. By comparison, New Zealand is about to open its 3rd memory clinic, which will be 1 for every 20,000 people with dementia. Now, before I introduce the first speaker, I want to leave you with this quote from Dr. Margaret Chan, Director General of the World Health Organization, who made these remarks at the World Health Ministerial Conference on Dementia in March 2015. And I quote, "I can think of no other disease that has such a profound effect on loss of function, loss of independence and the need for care. I can think of no other disease so deeply dreaded by anyone who wants to age gracefully and with dignity. I can think of no other disease that places such a heavy burden on families, communities and societies. And I can think of no other disease where innovation, including breakthrough discoveries to develop a cure, is so badly needed." New Zealand really needs to take the dementia challenge seriously now. Doing nothing is not an option, in my opinion, and there are some very real steps New Zealand can take to begin to mitigate the very worst effects. So we're going to hear from our speakers about how their parties plan to address this challenge and support Kiwis affected by dementia. And just to repeat, so you all know the rules, they'll each get to make an initial 2-minute presentation. And after everybody has finished, we'll take questions from the floor. And I'll make sure I'm very clear about the rules for all of you with your questions. But you could start thinking about your questions for once they've finished. Now, the speakers are going to come forward in alphabetical order by their party name. And we're going to wrap up absolutely by 7:15 because the members have to get back to the House. So I'm going to start off by welcoming our first presenter, Barry Coates, as I said, MP for the Green Party. Barry, the floor is yours.
I'll come to talk from here, if that's okay. My name's Barry Coates. I'm, as Kerry said, I'm the Green Party spokesperson on seniors issues. I've only been in Parliament since October. I previously ran Oxfam for a number of years. I'm an economist by training. I've worked overseas, done lots of different things in my life, and I'm not quite at the age that sometimes is the dividing line for seniors, but I'm not far off it. So one of the things that I wanted to talk about, and we can talk more in questions, is around taking a holistic view of dementia. And certainly prevention is really important through healthy living, through nutrition, through mental stimulation, and through exercise. Proper diagnosis and assessment, often that means getting over the stigma of dementia, so people will go for testing early. Then it's into living well, it's into proper services, etc. So I think we know what to do, and we've got a framework for dementia. The problem is it's not properly being implemented. And one of the things that we're doing is, together with Labour, the Greens and Grey Power are doing an inquiry into aged care across New Zealand at the moment. And that's absolutely fascinating, because what we're finding is all sorts of gaps in the system. And those gaps have emerged largely because of a shortfall of funding. The government, according to Infometrics, is underfunding health needs by around $500 million a year. We need to solve the funding problem, and the Green Party is committed to adequate funding for the sector. And we need to ensure that the pay equity deal, which we fully support, we think is great, it gives women a pathway in the care sector, is properly implemented in a way that doesn't cripple the providers. So let's talk more about that in a little while. Thank you.
So thank you very much, Barry. Now, because David is yet to join us, we're going to move on to our next speaker, which is the Honourable Maggie Barry. If you'd like to address us now,
thank you. Thank you, Kerry. Thank you, everybody, for coming out tonight. Kia ora tātou. You might have got caught at the gym, actually. We went past the gym. We nearly went in there, but then we thought, because I have a family background that involves dementia. Can you hear me all right with this? And so, of course, I'm aware that if you drink ginkgo biloba tea, you exercise well and live a blameless life when it comes to alcohol and so forth, and keep your weight under control. You can help yourself, but there's an incredible amount of extra work that does need to be achieved. And I'm very committed as the Minister for Seniors, and as somebody who has walked that journey with my own mother. I'm an only child, and when Mum was diagnosed with dementia, it was a very difficult time for us. My father had just passed away, and we had it became very apparent that Mum wasn't able to cope. And so over a 10-year journey, I learned a lot about keeping your sense of humour intact, keeping your faith, being kind and compassionate. And a lot of the things that I learnt with my mother over that period of time, when she did have to go into residential care after a while, has really helped me understand, as a Minister for Seniors, some of the issues around dementia. It's why on the 1st of July, as part of the Super Seniors brand that I launched, I changed all of our services for elder abuse. So we have a responsive service now, which is attached to an 0800 7-day-a-week, 24-hour-a-day confidential service, so that the most vulnerable can find out more about the issues. And I think that people with dementia are among the most vulnerable, as are their families. I can talk further about that in a little while, but I wanted to commend Alzheimer's New Zealand on the Dementia Economic Impact Report and on navigation, which they got from Tony Ryle, the New Zealand Framework for Dementia Care. Many of the things that were raised in that report, and I commend the work that Alzheimer's New Zealand has done around costing things out, around pointing us in the right direction. These are things that I fully support, and were we to be in a position of influence again after September 23rd, I will do my best to implement. Alzheimer's and dementia are very much at the heart of what I do as a Minister for Seniors. Thank you.
So thank you, Maggie. I'm sure you and the Minister, Jonathan Coleman, have given dementia and that issue a lot of thought. So it looks like we've just been joined by David. But just while you get your breath, what we'll do is move on to you, Ria. Now, Ria Bond is from New Zealand First, and she is now involved in the health portfolio. Ria, welcome. And If the polls are to be believed, you're going to be there, so we're all looking forward to seeing what New Zealand First has to say about dementia policies.
Thank you very much. I'm not sure I've got the microphone on, but I'm hoping that you can actually hear me. I've just discovered that Honourable Maggie Barry and I have something in common. Just recently I learned that my mother has rapid dementia, and for our family it's been really hard to handle because when you ring her she won't know who you are. She won't know whether you're her daughter or a son, and she'll think that you're actually harassing her. So we've had to learn firsthand how to tackle on our emotions, how to actually understand what my mum needs and many other New Zealanders as we see dementia growing in numbers. I think I read from, and this, I want to say that Alzheimer's New Zealand, with the paperwork they provided and the information brief that they gave me, I was really appreciative to actually how long term we need to address this issue and tackle the problem. And I want to say that when I had my briefing, I felt so, I felt peaceful afterwards because I understood then that there was a wraparound support for families and people with dementia, and I felt that was really important. In terms of what's going to happen after September the 23rd, at this stage it's anybody's guess, but I can honestly tell you as I stand here that New Zealand First supports the 3 strategies that Alzheimer's New Zealand has actually presented to us. It's actually it's a lot of common sense in there. There's real areas that families and our community members need assistance with, and we want to make sure that that indeed does actually happen. I should have read the rules tonight, and I didn't, because I've been running from here to there all day, and I didn't realise that you would have this prepared for you, so I was going to talk about this. I think it's really essential. We've got 30 seconds left. I think it's really essential that our New Zealand healthcare system is geared up to make sure that dementia is actually optimised and the challenges that we face are actually looked at quite critically. So dementia for me personally, on a personal level, is very important.
So thank you, Ria. Now that David has joined us, David, are you ready to?
Sure.
Do you remember the rules?
2 minutes.
2 minutes, you'll get a little wee tinkle at 1.5 minutes and the big loud ring at 2
Excellent.
minutes. So
Everyone else is sitting down to deliver.
no, they're not.
can
So you
stand
can
up.
stand, you can do whatever you like.
fine.
So
Walk around.
David
So
Clark
used to
is
it.
the Labour Health spokesperson. Welcome.
Welcome, kia ora koutou. Thank you for having me here. It's a real pleasure to speak with you about our views on Alzheimer's care. We have a strong view that the health system generally is chronically underfunded by $2.3 billion. That's Infometrics' assessment of how much more money would have needed to go in to maintain existing levels of service since 2009. So that's a starting point. We're going to put more money in. But we want to direct that money towards prevention and towards making sure that those services that are most cost effective are delivered for our community, so we're getting real value out of that money. It's one thing to put money in, but actually that gives you the opportunity to set the incentives right up to make sure that you get value out of it. And so we do support the things that have been put forward. It's very hard to disagree with them, as Ria Bond said. I mean, but we also think that there needs to be a strategy in place that actually sets out goals, looks at what's happening over time, because we know that while numbers now are 60,000, before too long we'll have 170,000 people to look after, and the opportunity to care for them in communities is going to require a new workforce, plenty of training, and a long-term vision for how we as a society better adapt to an ageing population with increasing needs. So it's part of a bigger picture, and we think that we need that focus. We also think that the current government's excessive focus on short-term targets is creating distortive effects in our health system. Just finished Atul Gawande's book on being mortal, and the importance of having conversations to make sure that you're getting the most value out of your years, having that support around you, rather than just looking to intervention after intervention. And so I guess that resonated with me, and I would like to see us with a strategy for tackling dementia that really looks to make sure people have as much quality as they can have in their years. Thank you.
Thank you, David. Now, our final speaker for this evening is Bali Nandu Kui Tabuki, and he is from United Future. Welcome, Bali.
Thanks so much, Kerry. Thank you, everyone, for coming out tonight. Tonight's quite a special evening for myself. As a young man that has just recently had a conversation with my mother, because she has type 2 diabetes, and she's had it for a long, long time. and because of that, it's actually led to the early forms of dementia being discovered in her. So this is quite a special night for me because I get to talk about what policies are important to me. So first of all, that stat that Kerry had pointed out, the 1.3% that's actually going to Alzheimer's patients, that's not good enough. So clearly there are a lot of funds going through to Alzheimer's, but practically where is it going? We need to ask these kind of questions because right now cancer research and all the other bigger diseases around the world have a lot of funds going to them. But in terms of Alzheimer's, I don't think enough exposure is being done. I don't think enough awareness is being done on the public level because right now, I didn't know anything about Alzheimer's New Zealand until tonight. So thank you very much, Kerry, for the formal piece of paper here that I have in terms of informing us about what services that we have, especially since my mother's getting to that age where I can start to see the effects on her. And I want to ensure that the services that we have in New Zealand cater to her in the best way possible. So some of the policies that United Future have are increasing the funding for dementia and Alzheimer's, ensuring that services within the public sector and the health sector are adequately fitted so that patients within their area and their communities are adequately serviced and helped to ensure that their families don't feel the burden, because at the end of the day, the family will feel the burden. And I hope we have a chance tonight to discuss more. So thank you so much.
Okay, so thank you very much for that. So now's the opportunity for you to ask questions. So if I could just put some rules around this. We know we've only got about half an hour left and we want to maximise the number of questions. So when you stand up to ask your question, if you could give your name and then ask a question. Please, no statements, a question. And if you could address it to one of the panel. I've been at lots of these and you want everyone to answer the question and then they all take 5 minutes and we'll only get one question through. So short question, no statement, ask it to the member of the panel you wish the answer to come from. And panel members, please, if you could try and keep your answer to 1 minute. And then we can maximise opportunities from the floor. So just while you are thinking about this, I'm going to kick off the first question because we have the opportunity to see the statements that came from the parties and seeing Maggie, you're in government. I'm going to ask you the first question. So the statement that's been provided by the Minister of Health, Jonathan Coleman, listed several initiatives that National has implemented, but each of these has now expired. So what specifically does your government intend to do in the future to support people living with dementia and to address the fiscal challenge that the condition will impose in New Zealand by 2050?
Thank you, Kerry. I've talked with Minister Coleman many times about this issue. As a health minister, he understands that with a growing population, we need to invest money in one of the major health challenges that confront us, and that is dementia-related conditions. Health was the big winner in this year's budget, contrary to what others might tell you. Health has a record $16.1 billion of spending this year alone, and that's an extra $568 million, which is the biggest single increase in 7 years. So across the board, Minister Coleman and the Associate Health Minister, Nikki Wagner, are also working on making sure that from the health budget, the Healthy Ageing Strategy that was released late last year, which has many, I think, fine indicators around health and the mental health of seniors, which is where dementia rests. So our approach is to take a holistic one and to make sure that the health system is funded adequately to look after dementia needs. We are very aware of the great work of Dementia New Zealand and in some parts of New Zealand, as well as Alzheimer's New Zealand. And I know from my own experience as patron of Alzheimer's New Zealand here in Wellington for many years that you get by on very little. But the level of awareness, the level of help that we can give as a government to the advanced care plans, to the memory areas, to the navigation system, these are all things that we are committed to doing. I can see by the way that Kerry is creeping around to the right there that my minute must be up.
I think it really is, but thank
Sure.
you for that.
Thank you.
So now's an opportunity. There are roving mics if you don't have a loud voice. So there's someone at the back there. Away you go, and then I'll come to you.
Look, like a few people here, my mother suffered from dementia, and just to add a bit of humour, she was diagnosed with dementia by Dr. Blackbeard, believe it or not. I always thought Dr. Blackbeard was a pirate, but apparently he's been resurrected as a dementia specialist in Nelson. My question is, the projections are pretty severe, 150,000 people by 2050, but there is a huge amount of research being done in this area, and would it be too unrealistic to expect that there might be a cure or some other type of thing that's developed before 2050, and that this isn't an issue in 2050? So probably I'll give that to Kerry.
Well, look, all I can tell you is what Alzheimer's New Zealand is trying to get the message across to the parties is that if more money is not apportioned to research, we won't get a cure. Okay, so that's our message. But does anyone, David, I'll give you this one.
Just a passing comment. We know that the preventative measures in the NCDs, the non-communicable diseases, obesity, smoking, if where possible supporting people facing mental health challenges, those things have a preventative effect. So, I mean, it's not a cure in the form of an injection, but it's definitely something we know can ease the burden if those things are properly resourced, and I would argue that they're not currently.
Yep.
Can I just add one little thing on that, or am I not allowed to?
No, only one, but I'll let you next time. You can add it to your answer.
Thank you.
Hi, my question is to Mr. Clark. You're the only person that mentioned workforce, so I'm really interested to hear what Labor's views are on what the workforce you believe as a party needs.
Yep. Well, we want to make sure there's really, you will know that there is different standards around the country. There's also different levels of DHB funding in different areas. There's a huge disparity. We would work with Workforce New Zealand. We'd want to maximise the allied health workforce component, but we want to make sure people are appropriately trained and qualified, because but you need oversight, but you also want to make sure you're getting the best value for money. I think any government would want to do that.
Yes. That's fine. There's a microphone coming.
Thank you. Honourable Maggie Barry, I'd like to ask you this question. Does the government have policy to support men and women with dementia under 65 who have different issues to those older, e.g. still working or have children still at home? At present, the health system is geared for those over 65. I'm living with dementia and I'm 59.
Thank you for asking that question. That is something that is becoming more prevalent, and we know that the earlier the onset, it can progress at quite a rate. So residential care facilities are now embracing more of a younger cohort, a younger group of people, and I agree with you that it needs a different approach. One of the things that was asked earlier, and I think is relevant to this, is that traditionally in the aged care sector, it's been difficult getting the right level of staff and qualifications, and because of the $2 billion pay equity that we put through, some 55,000 aged care workers who need varying degrees of specialty, in my view ranging from kindness and compassion through to clinical care as well. But there is now a career pathway, and therefore a much more, I think, able to be targeted properly at individuals' needs rather than a one-size-fits-all approach. So I'm very encouraged that it will be more of a profession than it's been in the past, that you will have good staff that stay on, and that as we look at the Dutch example for where they have village situations where people can live at various stages of dementia but in a normal environment. But we do want to keep people in their homes a lot longer. The Dutch model is about to open in Rotorua, which I think is a very exciting development because it will help younger people suffering from dementia. But thank you for asking that question.
I'm sorry, I forgot to say my name.
Jenny.
Thank you,
Jenny. And good luck. Yes, sir.
My name's Bede. My father died about 3 years ago from early onset Alzheimer's. So I've got a two-part question. The first part is fairly straightforward. Maggie, are you the national person?
Yes, I'm the Minister for Seniors in the National Government.
Okay, so I thought I'd address this towards national because you're in the government. So I've heard a lot of statistics today around Alzheimer's. I'm not sure which ones you've said, but there's a very small percentage of people with Alzheimer's that fall into early onset. Is the funding towards early onset research in relation to that proportion?
One of the things that we're doing is there's a pilot that's being run at the moment up the Kapiti coast, which is looking at the various appropriate ways of having people in their own homes, whether it's an early onset or later. So having them in place, staying in their own homes where they're familiar for a long period of time, but having community groups come in and help those, and the health system itself, of course. So if I've answered your question correctly, there are also a lot of older people who have special additional needs, maybe what they call comorbidities, where you have another illness as well. So that's managed holistically across the health system. Again, we're trying to plan ahead so that people will be able to stay in their own homes, in their own communities for much longer, no matter what the age. Mum was 84 before I had to move her into a residential care facility. And I kept her at home for 4 years with people looking after her.
Yes, thank you.
It was in 2 parts. Do you have another part?
Oh yeah, the first part was just who's national.
Oh, okay.
I didn't wear my rosette.
No, none of us did.
Now, we need to be fair and ask some of the other parties, otherwise Maggie's not going to get to sip her wine.
It's bad for me anyway. Yeah.
Yes, sir.
Yeah.
Oh, sorry, and then I'll come to the gentleman at the back. You go first.
You going to go first, sir?
Yeah, he's going to go first here.
Oh,
Sorry,
I'll
and then the
go
one at the back.
Tato. Trevor McGlinchey from the Council of Christian Social Services. Barry, you mentioned in your introduction the great degree of pleasure there was about the pay equity settlement, and we certainly echo that. But the fact that the way it's being applied is having a bad effect on some of the service providers. What kind of approach would your party take to ensuring that the actual implementation of the pay settlement and the increased pay to carers would be more better applied?
Yeah, thank you, Trevor. So, as you probably know, the pay equity settlement came not as a result of initially government policy, but actually from a case that was taken against the government against Terra Nova, actually, and eventually it ended up in a pay equity deal. Now, the providers of aged care in particular are currently facing difficult times in being able to continue either home care services or residential services, and particularly in rural areas and in small towns. One of the things we're really concerned about is the smaller facilities in areas where people have no alternative. So if they don't have a residential care facility locally, then their families have to go into the nearest big town or city in order to visit their relative when they go into residential care. I think that's a major problem, and I think that we need to understand better the situation that providers are being put in, and providers are closing down at a rapid rate across New Zealand, as I'm sure you know, and so we're committed to looking at that carefully and trying to find a solution. It may end up being a differential payment for not-for-profit services or community-based or faith-based services that recognise a particular caring model. And I think that issue around what's the caring model that is being provided is really important in this discussion, because dementia should not be treated in residential care by shutting people up in a room and protecting them via closed doors. And I think I visited one of the Eden Alternative retirement homes just 2 days ago, and they had sort of a wonderful environment where actually they'd gone out of their way to create the supportive environment where people with dementia played a very active role in the management of the rest home and in the community. Sorry, that was a little long.
It was a little long, but
thank you for the question.
With one or two of the others. So down the back, yeah. Sir.
My name's Don Rennie, and I'm the chairman of the board at Sprott House, where Maggie's mother was looked after by us.
And Kerry's father.
And it just concerns me that the settlement of the pay equity case has been regarded as, I go very much by what the last speaker said, it was regarded as some sort of a boost to the provision of aged care, and it's not. It's caused more problems than it's solved, because we are now left in the not-for-profit area of having to find some way of carrying on to provide a service. Now,
So could you
At the moment
turn
it-
your statement into a question to one of the...
my question, can I make one more part of my statement is that it currently costs $53,000 a year to keep somebody in hospital care with dementia. And I know that from a personal point of view. Now,
So your question is?
my question is, would the government be prepared to regard any income that is directed towards aged care be tax deductible at least?
So this is to...
This is to me, Don.
Yeah, Maggie.
Don, well, one of the things that has worked very well for our economy is that we have an uncomplicated tax system and that it works very well the way it is. So the more additions and complexities you put into it, the more expensive it's been. So traditionally our ministers of finance, who've got us back into the black where we needed to be as a nation, have felt that that's the case. I wonder if there aren't other approaches that we can discuss around this. I know that Sprott provides an excellent service. We both feel that, I think Kerry as well. My mother is actually waiting to go into Sprott House when your father was being brought out.
Yeah.
And I had a friend whose parent was coming in when Mum passed away as well. I know how much demand there is, but I also know how much your staff were unhappy with the way that they were being paid. And I have to say that 55,000 people around New Zealand who are going to be benefiting from that $2 billion pay equity do deserve to have an extra $5,000 a year, in my opinion, and that it has been an underpaid area because of the gender equity issues for far too long. So I'd be very happy to talk with you. I think the tax is not the way to approach it, but I stand by the settlement, and it needed to happen for the good of everyone. But I'm interested to hear how it has its complexities at the delivery for not-for-profits. So I'm not unsympathetic, but I don't want to turn back the tide on what was the right and the fair thing to do for aged care workers.
So I've got a number of questions now. So if there's time at the end, David, you could have a chance. And I know a lot about this because I haven't actually declared that I am on the board of a big rest home supplier, Oceania. So I know exactly the issues you're talking around as a result of the turnover. So we have 49 different facilities across the country. Who's next? Yes, please.
Thank you. Anne Schumacher from Alzheimer's Wellington. I'd like to ask Greens, please, how you see funding being directed into community care as opposed to residential care.
Yeah.
Because we know for a fact that it is the majority of people with dementia live for many years in the community. And I'd like to know what you would do to support people to live well with their dementia in the community.
Thank you. And I in previously talking about residential care, I should have been clearer to say that we totally agree with the strategy to keep people at home in their community with their family for as long as possible. And that's obviously economically better, but it's also better from a community and a personal and family level. So what do we need to do in order for that to happen? One thing I don't think we've got right is we haven't got the situation with paying carers fair to family members. That actually we need to stop discriminating against family members as carers and front up to the fact that we should pay carers and that we should make sure that we remove the blocks to respite care, because the carers bear a huge burden. And sort of another disclosure, my mum had dementia and I looked after her for a while, and I just completely respect anyone who looks after a relative or anyone with dementia, because it is a really difficult and challenging thing to do. So we need to look after our carers really well. For me, that's the crucial dimension.
Thank you, Barry. And that's right. She was seeing my winding hand.
Oh, okay.
You're not giving me eye contact, so you carry on.
Figured that one
Now
out.
we've got two women here. Yeah. Well, there's a lady in a nice blue
Ladies
jersey,
first.
and then another lady in the row behind.
Hello, my name's Rose, and my mum had vascular dementia, and I've got in my hand the framework which mentions a navigator role about 35 times and in depth, and there's a cost for us if we're helping to navigate our loved ones through that system. And I wanted to ask the gentleman from United Future, but I thought that would be really unfair because I'd be landing you and I was going to ask you, how are you going to navigate your way through? But I'll ask the gentleman from Labour because I feel it would be unfair because many of us here have navigated our way through and each of us reinvents the wheel. And I think it's really important that we actually know when is that role of a navigator actually going to have some funding behind it. So I wanted to ask the gentleman from Labour, are you guys going to make it happen?
Yep, I actually met with some people from Alzheimer's New Zealand and discussed this through, and I can tell you that I have turned my office upside down looking for the bit of paper I wrote on. I'm looking at Mary Slater, who I asked questions about it, and the costs from memory were not exorbitant. That's my recollection. And I can't see why we wouldn't do this. And the question you ask is one that I welcome because this is one of the big propositions we're taking to the election is more funding for the health system. Yep. So Labor is promising $8 billion more than the current government for health, which is not small beer. It's real money, $8 billion. We are not offering the tax cuts that the government is offering in election year. So, you know, it's a clear choice. We're saying if you're looking for a tax break for your second Lamborghini, don't vote Labor. You know, you really aren't going to get that from us. We are committed to
the Porsche.
Putting money into the health system and the education system. And if you don't fund these roles, if you don't fund the healthcare, services get cut, and that's what we've seen. It's harder to get cancer scans now. It's harder to get hip surgery. It's harder to get your cataracts done. It's harder to access mental health care than it used to be. And those things have happened because in real terms, given an ageing population, money has been stripped out. And the figure 2.3 billion is the best estimate for an independent look at the Treasury data. You know, that's not a number we've come up with, that's Infometrics looking at the Treasury data. 2.3 billion is what's been stripped out since 2009. And we're proposing to meet costs going forward and over time, you know, those are carefully chosen words, put that 2.3 billion back in because our priority will be healthcare and not tax cuts.
Yeah, of course, if we were in the House, I'd have the opportunity to say
but you don't
16.1 billion.
You don't have an opportunity.
No. But don't speak about our policies, particularly if you're going to get them wrong, David.
I'm going to give the call next to the lady. Yes, but before Bali, I know that question could have been directed. Do you feel confident to answer that as well? Otherwise, I'm feeling he's going to miss out. For your mum, yeah.
Yeah, look, in my personal point of view, this is an issue I will have to eventually one day navigate with my siblings as well, my sister and my little brother. Personally, I would come to Kerry. I would come to Kerry and this organisation as well because you guys have done such a great job and see what is the easiest way for my mother to ensure that her quality of life is not affected when she gets to that age where things are starting to get really, really bad. So that would be my personal response, and that's why I chose to stand for United Future, because I feel they have the best policies to do that.
Good answer. Now, he shared with me before we started, he went to Tower College, and I did too, but I left in '69, and he tells me he only left in 2008. It's quite a long gap, but he's learnt well. Now, Madam.
Hello, I'm Joshika. So there have been two questions before related to early onset Alzheimer's, and you said earlier that dementia hadn't had much exposure, and I feel like early onset has even less exposure. So questions have been asked about the support that families of people with early onset Alzheimer's would get, and I don't think we've actually heard an answer. So, you know, the partners are still normally working, they've got children that are still at school. What kind of support are these people going to be getting? Do you have any policies related to that? Or?
And while I am going to ask Maggie to answer that, Senior in Government, just to remind you that at the moment only 1.3% of the total 1.7 is spent in supporting carers and in respite for people who do stay at home, no matter what their age is.
Yeah. I think respite care is incredibly important no matter what degree of dementia is involved, and that has been an ongoing challenge to find the bed space to put someone into care for a period of time. When it comes to caring for the carers, we released a strategy last year which launched a new website and enabled a connection between the carers, whether they were paid carers or whether they were carers who were from family. And that was for people with disabilities as well as with dementia. And the two, the linkages are quite apparent because the level of isolation that carers are in, and also the loneliness of not being able to talk to people about what you're going through. And I found with Alzheimer's Wellington, when I was the patron of it here, the most valuable elements of it, apart from supporting Alzheimer's and its great work locally, was also the fact that we needed to try and get a grip on just the things that were important to support each other as human beings through what was a mind-bogglingly difficult thing sometimes, to actually understand what was happening, to not be recognised by your parent, for some siblings to take it personally, for there to be misunderstandings. No, but I mean, early diagnosis is one of the things that needs to be talked more about, because the longer you leave it, as with deafness or any other issue, the more room there is for misunderstandings, and I know families that have had terrible suffering as a result of that. So the caring for the carer strategy has been, I think, very successful. I don't know how far it has spread, but as the Alzheimer's saying goes, let us not forget those who can't remember. But that also includes their loved ones.
Thank you.
A question for New Zealand First, and I just want to thank all of you who have shared your own family connection and experience with dementia. I really appreciate that. But a question for New Zealand First. What do you see as the single biggest priority that New Zealand First would address first in dealing with the dementia challenge that New Zealand is facing?
Well, first of all, ensuring that the 3 strategies that Alzheimer's New Zealand has outlaid are actually supported. Sorry. Yeah. Do I turn it up a little bit?
Oh, they'll do
Just
it from
speak
there.
up a bit, I think,
Okay.
yeah.
So sorry for those that didn't hear, the first thing that New Zealand First would do would actually to take a look at the 3 strategies which we have looked at and actually identify in terms of the navigation framework that's there, make sure it's funded appropriately. We also have, when I say we, it's myself and Barbara Stewart, have sat down and talked about the issues with dementia. We think that early diagnosis is really quite crucial. We think that education for family and community is a very important area that has to be identified quite early too. What I do want to say is that in terms of the funding, I know that for every dollar spent, we get back $6.60. So that's actually a savings of putting in place what Alzheimer's New Zealand has recommended to us. So I've kind of like pushed quite hard back on some of my members, saying to them that this is actually quite critical. It's really critical because as we age as a country, we're going to find dementia becomes more of a challenge. So New Zealand First will certainly pick up with the policy and the strategy of Alzheimer's New Zealand and implement that.
Now I've got a whole lot of questions over here, so we'll go to the front row and then the second row and then the fourth row. And then we're going to be just about out of time.
Kia ora tātou. I'm Philippa Fletcher. My husband had today the experience of trying to apply online for New Zealand superannuation and found that he really was going around the block, despite the fact that he's very smart and was an A student at school. I was actually wondering, and this is actually really to anybody who wants to answer it, because I'm really looking for ideas, how we can make New Zealand government services more dementia, Alzheimer's friendly.
Who wants Maggie? Well, I'll let Maggie and David have a go. So you go first and then David.
I sympathise with you. One of the things that we did with enduring power of attorneys was lessen the document from this down to this while still being legally binding, because it was full of legal gobbledygook. We are, as a government, trying to encourage people to do more things online. For superannuation, we want to make it even easier so that there will have to be an opt-out clause if you don't want your records automatically transferred, so that they automatically start paying you at the time, on the day of your 65th birthday. So we're encouraging things to be as simple and straightforward as possible. Having said that, there are sometimes complexities where you do need somebody that you can talk to about your own case, or in your husband's case, and if there's dementia involved, for example, I've written to all the banks and the government departments requesting that they have special training, and this has now been picked up by the Banking Ombudsman and across the government sector as well, across 9 different ministries, that they are trained in recognising dementia to help individuals.
David, a very quick response, because now Barry's getting really cross with me.
Advocacy is something that I really want to see properly resourced, and this is probably something Barry might also want to say. We've done it together, the Greens and Labor, an inquiry in the aged care sector, 2010. We're just in the process of updating that. Barry and I have travelled around the country talking to many audiences, and one of the leading recommendations out of that I expect we will re-announce, I hope I'm not breaking great confidence here, Barry, is an aged care commissioner. We think it makes an awful lot of sense to have someone independent who can investigate when things go wrong or advocate when processes are not simple or easy to get through. Somebody whose job it is to represent those who cannot easily represent themselves.
Okay, so well played, and he got an MOU, so he spoke on your behalf, so hopefully one of the next people will ask you a question.
We do have a retirement commissioner, of course.
Sir, yes?
I'm Eddie. I'm an advocate for Alzheimer's research. My wife was diagnosed with Alzheimer's at age 66, died last year at age 74, so I do know a little bit about care. But the thing that I'm talking about is the research funding. And I'd like to refer this to Ria from New Zealand first. Alzheimer's is a disease, and there's a good chance it can be cured. And it can only be cured if we research it and find out how we're going to cure it. Financially, if you could cure it, you'd save the country a huge amount of money.
So the question is to Ria?
And my question is, the current funding for Alzheimer's research is 0.3 of 1% of the dementia budget. Would your party consider doubling that research figure? Thank you.
Thank you for your question. I want to say that because my mother does have rapid dementia, of course New Zealand First wants to see a cure. Of course we're quite concerned about the fact that we do need more funding for research in order to try and find a cure. So in a short answer to you, yes, we would look at increasing that.
Now, I just should remind our panellists, this is all being recorded, it's going to go online, and there'll be witnesses.
I better ring my boss.
There, and then 2 rows back, a lady, and then maybe that might be the last.
Hi, my name's Lynette Tippett, and I'm from Brain Research New Zealand. I'm interested to know, I'll address this to Maggie, that the figures that have been quoted tonight about how many people have dementia and how many are projected are all based on extrapolations from data from overseas. Will your party commit to a prevalence study in New Zealand so we can get a real picture of the actual incidence or prevalence of this condition in New Zealand, given our own unique ethnic composition and the fact that those factors may well mean we have quite a different rate of dementia?
Sure. Thank you, Lynette. I think and at this point I would like to acknowledge the work that Alzheimer's New Zealand have already done in this country, looking at the people who have got dementia and extrapolating out the figures from there. It isn't an arbitrary thing. They put a lot of time and effort and work into it, and it did an ethnic breakdown as well. Sorry, I'm just trying to keep seeing you at the same. No, it's all right. But so the Alzheimer's New Zealand work and the work that's being done under the Science Challenge as well is looking at some of the early indicators and what are the prevalent demographic groups, and that includes the ethnic groups as well. So I don't have the figure with me as to how much we're spending on that, but I know that the pilot that's being done on the Kapiti Coast, which is one of 2 places in New Zealand where the ageing population is quarter of it's over 65, so it makes sense to start in those places. And no disrespect to people who are worried about earlier onset, but the information that we've got and that we're building on is giving us a pretty clear clear picture. And we do need to know the numbers and the ethnic dispersal. The rates for Māori are higher, and some of the indicators that Alzheimer's New Zealand have put in are around lifestyle and other issues around diabetes and so forth. So it is a multifaceted approach that we're taking. But it's important to know what New Zealand, where we're at.
Hello, I'm Claire. My question is around dementia-friendly communities, and we've touched upon aspects of this as we've spoken, but I wanted to explicitly ask if there's anything in your policies to encourage and enable dementia-friendly communities, how we get businesses to respond, to help people continue going to their local supermarket, the bank that they go to, something that the health system and others can help towards this challenge.
Who are you addressing that to?
I'd be interested to hear from Maggie around how it fits with age-friendly societies and dementia-friendly
So why
together.
don't, just because this is the last question, we'll let Maggie briefly, and then we'll let Barry, and he keeps looking at me wickedly like he's been missed out, and then we're going to have to close it off.
So as a Minister for Seniors, I funded positive ageing and ageing communities. So the idea of age-friendly communities and whether New Zealand can attain age-friendly status as a nation and be the first to do that is something we're working towards. That Dutch example, the village I mentioned before, where people at all stages of dementia can live in an environment which is vaguely normal, is something. The Rotorua example opens, I think, in October. So there's a lot of work that's been done on this. But dementia and disabilities, blindness and so forth as well is very much at the heart of what we're doing with those age-friendly communities.
Barry, last word.
Thank you, Claire. I agree it's a really important issue. There are protections that have to take place. You know, my mother got basically had some bad experiences of people ripping her off from when she went shopping. So there's a whole sort of community aspect to this of the community has to respect people with dementia and take care of them. So you know, one of the broader changes as a society is, I think, you know, we've got to start acting more as a caring society and with caring communities, because that's fundamental to creating that dementia-friendly aspect to our society, and certainly Green's policies are aiming in that direction.